KSJE is proud to support the 13th annual Sassy Tortoise and Hare Run, Saturday, April 5th, to benefit sexual assault services of Northwest New Mexico. The run will have a 5K, 10K, and 1-mile stroller roll route. You can run or walk either the 1-mile or 5K. It all starts at 10 a.m. Registration is online at runningguru.com. Search Sassy. The Tortoise and Hare Run, Saturday, April 5th.
Ten minutes past 8 o'clock. It is Tuesday morning, the first day of April 2025. No fooling. Good morning, everybody. I'm Scott Micklin, and thank you for tuning in to KSJE 90.9 FM over the air here in San Juan County, New Mexico. In Durango, Colorado, we're broadcasting today and every day at 103.3 FM. And if you're listening anywhere else on the planet, you've gone to our website to do that, streaming all the time from KSJE.com. Welcome also to our viewers who are joining us this morning. The video of the program is streaming out live to the KSJE Facebook page and also to our YouTube channel. So welcome aboard, everyone. So glad that you are with us, because coming up in the next few moments, my guest from the San Juan Health Council. We are getting an update on the recent Health Expo, also some of the other things that the Health Council is working on this month and the spring. Stay tuned for that, coming your way in the next few moments right here on KSJE today. Later on, of course, we'll be talking with Amber Francisco from the Farmington Regional Animal Shelter. She'll be talking about the cat that you see on the screen and some other animals ready for adoption. And the name of that cat, let me check my notes. Cray Cray. Yeah, that's the name of the cat you see on the screen right there. So we'll learn more about Cray Cray coming up later on this hour on KSJE. May Cass, who is not Cray Cray, will be joining us next at 9:06, Roving with the Arts. Lots of classical music coming your way next hour here on KSJE as well. You can also connect with us on Instagram and X in addition to Facebook and YouTube. And if you're a podcast person, you can find KSJE podcasts wherever you're listening to podcasts. So check it out and maybe discover a new local program that you may have missed recently. Get ready for some wet and windy weather coming up this week. Take a look. Today, mostly cloudy skies, a 50% chance of rain or snow showers starting up around noon today, and we could see some wind gusts that by about 50 miles per hour this afternoon. The high today only 50 degrees in Farmington. A windy night overnight with more chances for rain or snow showers. The low 26. Tomorrow, another chance for rain or snow showers, 50% with a high of only 47 on Wednesday. More rain or snow Wednesday night. Again, Thursday, more chances for rain or snow with a high of 44 into Friday and Saturday. A wet several days coming up with overnight lows near freezing. Maybe things dry out a bit with partly sunny skies by Sunday and a high of 53 degrees. Back with my guest from the San Juan Health Council right after this on KSJE. KSJE is supported by San Juan Regional Medical Center. The most important ingredients to sustaining health and wellness are the resources and tools that help you live a vibrant and healthy life. At San Juan Regional Medical Center, the goal is to promote health by making sure those resources are available. Find the path to the best life at lifebetterhere.com. San Juan Regional Medical Center. Better is our mission, improving lives through personalized health and care.
Life is all about getting from one place to another, from home to work, between school and the store. But what if you don't know exactly how to get there? That's where the Navigation Center can help. Maybe you've lost vital documents, need help with housing, or can't find a medical provider. Located inside Presbyterian Medical Services at 1001 West Broadway, the Navigation Center can help you navigate life's challenges. The San Juan County Navigation Center, connecting to resources, empowering lives.
KSJE is proud to support the 13th annual Sassy Tortoise and Hare Run, Saturday, April 5th, to benefit sexual assault services of Northwest New Mexico. The run will have a 5K, 10K, and 1-mile stroller roll route. You can run or walk either the 1-mile or 5K. It all starts at 10 a.m. Registration is online at runningguru.com. Search Sassy. The Tortoise and Hare Run, Saturday, April 5th.
I'm back in Studio A this morning with my guest, as I mentioned, from the San Juan Health Council. Amanda Evans is joining us this morning. Welcome back to KSJE. Good to see you.
Good morning. It's great to be here.
Thanks for coming in and talk about a couple of things that have been going on. One is the successful Health Expo that you and I have been talking about for a bit as well. That was very successful, huh?
That was. We had it last month in February. Well, it's been
almost, right?
We're a whole nother month now. And so we had a great turnout. This was our second annual. So we increased our vendors, we increased our community participation. We just had a great turnout, and people were really excited to get some information on health programs, and even vendors who were selling some healthy items and different options in the community.
Right. Very good. Exciting. And congratulations. And so more vendors and more people through the gate, I guess, right, at the event.
Yeah, so our first year we had around 50 vendors and about 550 people come through. This year we were up to 84 vendors and our door count was 849. So we're really excited with the growth, and we've already scheduled next year's and put the money down on McGee Park. So we've got our date saved and ready to get going.
Okay. What's the date? Do we know what the date is?
Saturday, February 21st, 2026.
Okay. Seems like a long ways away, but I know it's not.
But it's already April, so
I know.
we're going fast this year, too.
That's true. Very good point. But congratulations. And again, big thanks to all the vendors and all the other folks who came out, because you had more booths filled as well this year.
Yeah, we had a great turnout. We had local health providers. We had vendors that sell healthy stuff. We had we had some life coaches. We had two people who did massages on site and gave you a taste of kind of what they can do if you need to get some relaxation and stuff. So we had just a lot of wonderful people that really showed up and handed out goodies and sold stuff and just made the day a great success.
Nice. Very good. And from talking to the folks who attended, I mean, did you get some good feedback from them? Were they getting some good information and worth their time, I think, to come out and hang out at the Health Expo?
Yeah, we tried to bribe people to do a survey because, it more like pay them for their time kind of thing. But we did do a drawing, so we had people fill out a quick survey at the end to kind of give us some feedback. And overall, it was really positive. And one person got to win a $100 gift card, and so that was nice for them and nice for us to get some feedback as well.
Nice. Very good. Well, again, congrats, and looking forward to next year and putting all that together even bigger and better, hopefully.
Yeah, we're going to try to get to around 100 vendors and hopefully increase our numbers, try to get the media. You were great help getting the word out, and so hopefully do even more next year and really let people know about it.
Excellent. Happy to be a sponsor of the Health Expo. And again, you've got room to grow having it out at McGee Park, I guess, so you can kind of expand a little bit and get more people and more vendors in 2026.
Yeah, that's really the plan. That's why we chose McGee Park, is we know it kind of works for smaller events, but you can definitely grow into it and not be too close and tight and things like that. So we've got the space, and we definitely are going to start planning. We'll start getting a group together to really work on outreach and stuff this summer. Very
good. Well, again, congratulations, and great to hear. In addition to that, the work of the Health Council continues to try to talk about some other things that are going on in the community and make people aware of some of the resources that are available, not just maybe here, but statewide as well. What are some of the other things you guys have been talking about recently at the Health Council?
Right, so we meet monthly. The Health Council meets the third Thursday of each month, and we get together with different organizations. We do presentations. This last meeting, we worked on some vaping and tobacco education stuff. So we're really promoting. The state has a great website called NUPAC, which is NUPAC.nm.com, and so that gives resources like 1-800-QUIT. That gives some prevention stuff that can be used around vaping, tobacco, e-cigarettes, all of that kind of stuff. So we're out there letting people know that there's this resource and they can go and get information. This month's meeting in April is going to be on suicide prevention. So we're going to have two different programs that are doing some training around suicide prevention, and they're going to come and talk to us about what their programs do, how an organization might be able to get their employees trained on suicide prevention if they work with either youth or adults that might be kind of at a high risk for that.
Right, very good, and so that's important stuff. Is there some things from the legislative session that you are watching, some bills and things that were passed, maybe waiting on the governor's signature, or there's things like that still? I know she has a couple more, maybe week and a half to decide whether to sign or not sign some bills.
Right, and so, of course, our Health Council funding across the state is in the Department of Health's budget, so we're waiting to hear about that. And, that's a big thing because we don't have a kind of system like other states do for health. Other states, instead of having health councils, they have public health departments. And we're really lucky here in San Juan County because we have both. We have a public health department and then the council that can work on other projects. But some of our smaller communities throughout the state don't have health departments, so it's really important that they are funded to where they can do some of these prevention and even some of these direct service programs that they might be missing from not having a Department of Health in their community.
Got you. And that's what that funding would pay for, is some of the health councils in other communities. Right.
And so that funding helps pay statewide. Each county has a health council.
Right.
Sorry, it's early on the morning.
It is.
Has a health council, and so that makes it to where they have this planning group that can really help their community decide what programs they need and how to get the resources that some of the bigger communities in the state already have.
Got you. And so in those places, then I guess the health departments are more regional then, I guess, because then those communities are supposed to just deal with the health department in another maybe larger area nearby. Is that the idea?
And they do, like the public health offices do service more than just, like one area in some places. So,
right. But you're right. In Farmington and San Juan County, we have the public health office in Farmington that services much of the county or all of the county and maybe a little bit beyond.
Yeah, and they have done, they're in the process of really getting set up with mobile health units. So
nice.
They have, they're working on getting all the licenses and stuff, but they can go out to events, to schools, to different communities in the more rural areas. We have a lot of that even in San Juan County that might have a hard time getting into Farmington to get some of the services, vaccines, things like that. And so this mobile unit will be able to go out into those more rural areas and provide those services, provide testing, provide vaccines, provide all this stuff that you would have to travel all the way into Farmington to get. So we're really excited about trying to help them promote that, and really, as they get these licensed and they get these get it up and running, this whole program, it's going to be really beneficial to the community.
Right. Very good. Well, and that could be maybe a future show.
Yes.
When we talk, since we are committed to talking with the Health Council every month, which has been a great partnership over the years. So, and bringing one of your members to come in and talk about some of the things that they are doing as well. You've got a community survey that you're putting out there, asking for folks to take part in it.
Right, and this is not necessarily our survey, but this is a state survey.
Okay.
And so what we do is just help promote it to the community here in San Juan County, because this gets not just results for the statewide, which are useful in some of our federal funding that the state applies for, but also it's really helpful for communities because it tells us it's solely focused on kind of substance use issues, where some of the other surveys aren't. And so that can help us get funding around topics like alcohol use, around vaping, around drug use, and things like that, and gives us data points that we can then use to apply for some of this funding and start new programs and kind of prove what is needed and not needed in the community.
Gotcha. We're showing the poster right now about it. There's a QR code or a link that folks can go to take the survey. I guess there's a chance to win some money, some cash money if you take part in it. So it's open now till the end of this month, April 27th. So people have a few weeks to do it. How long is it?
So I will admit it's a little longer than most people want to take. I forgot what the question count is for this one, but it is kind of long and detailed, and that's why they do offer prizes. And it's $100 to 3 people every week, so you're not like, they don't wait till the end and have like 1,000 entries or something. It's every week filling it out. You can only win once, but
so I guess the sooner you do it, the greater the odds that you would maybe be a winner than waiting till the very last week when everybody's in it to win a potential prize.
Well, yeah, because there's a big push at the end to get
Yeah,
our numbers and things, and so this really, the more people we can get to fill this out, really helps give us more data to work with. And so when, San Juan County Partnership is the fiscal sponsor for the Health Council, and so that's how we all work together on these projects. Is that helps determine Health Council priorities, but also works with the partnership on putting out things. Some of their vaping programs. We use data on our alcohol presentations we do with youth. So this really gives us some information that then we can return back to the community through various ways.
Sure. And again, this is a statewide survey, and so you can get the data broken out, I guess, into San Juan County's data, and also see how it relates to the rest of the state, and see what the trends are, I guess, over the past years and things like that, and see where things are headed, I guess, when it comes to substance abuse and things like that.
Yeah, and this is we use it really as not just a funding tool, but also an evaluation tool. So we can see, are the alcohol programs we've been putting in place. We've seen a decrease in youth alcohol use over the years. And this is one of the tools we use to judge that. But we also use the YRS with youth, which is the Youth Risk and Resiliency Survey. But one of the great things about having multiple tools is that then they can reinforce. If we see a trend in one survey, it might be a trend, or there could be outside influences into that. But if we're seeing it across like 3 different surveys, then we know we're really having an impact.
Right. And one of the things I think that this survey has shown, but please correct me if I'm wrong, is the use of vaping across the state and in the county, and maybe the ages of kids, and I mean that literally, kids that are using vapes and things like that, that the age seems to be getting a bit younger in every survey that maybe comes out. Is that accurate?
Well, and the YRS focuses a little more on youth use than this one.
This one? I gotcha.
So, but again, we can put those kind of trends together and things like that. But
okay.
We are definitely seeing youth use with vaping. What's kind of surprising is we're not seeing a majority of kids like we think. We've actually seen lower numbers than what we kind of expected, because there is this prevalence of every youth is vaping, and that's not really true. We do have definitely a higher percentage than we would like to have on there. And we have kind of stories from people like nurses in the public schools where, they're catching first graders with vaping devices. And we definitely don't want to see that, because we don't want kids to be, one, it's such an impact on their brain and body, because most vaping devices do have nicotine in them, even if they're promoted as not, because there's no real FDA oversight into what's in some of these liquids yet. And so something might be promoted as just a flavor, but really it contains nicotine as well.
Just a flavor plus other stuff. So interesting. And so that's important to know. And I guess what this survey would tell you, though, is maybe the usage of vapes with adults then, right? And maybe that's getting a little bit higher.
Right, and I don't know the trends off the top of my head with adults, but we're definitely seeing more people using vapes than cigarettes, and because one of the biggest kind of lies that we've been told, again, like with cigarettes when they were healthy and okay, is that vaping,
as long as you use a filter, just use the filtered cigarettes, much healthier.
Yeah.
Right.
And I think over the years we've shown that's not true.
That's not April Fool's, folks. Yeah.
And that's been kind of, I remember, 5, 6, 7 years ago, the local newspaper did an article on vaping as a healthy alternative because they were putting vitamins in the vape liquids. And that does not make it healthy, because there's still a lot of chemicals that go into the vaping device themselves. It's not really a vaping liquid. It's an aerosol that you're inhaling. They've even proven that there's secondhand vape that you can, even if you're not the one vaping, you're still getting some of the
effects. Can be damaging to someone sitting next to you or whatever in the same room, right?
Yeah, and that's one of the projects we're actually working on, is putting a whole, Julie Smith is one of the partnership employees who does this out in the schools, and what we want to do is make this information really available to anyone, whether they're in a school or not. And so we're in the process of putting a longer video together that's about 20 minutes that goes through her whole presentation and really breaks this down, like what does have nicotine, what is the effects of the vaping liquids, all these different pieces that people might not understand yet.
Got you. Very good. And Julie was just here last week talking a bit about the work that she does with the San Juan County Partnership. So folks would like to check out that conversation, you can find it as a podcast or as a video on our Facebook or YouTube channel. So check it out, and you can learn more about what the work that she does and the San Juan County Partnership as well, because their executive director was here as well talking with me that last week. And so with that survey, that's just one of the things that the state does every year, I guess. It's a yearly survey. Yes. To ask about use and addiction and things like that.
Yeah, and so the New Mexico Community Survey is one of the few that's done annually. A lot of our others, like the YRS, is done every 2 years. The San Juan County Partnership Needs Assessment is done every 4 years. So this is one that really helps us get that interim data, so we can see really quickly how things might be going versus waiting 2 or 3 years to get data in between some of these other surveys. So that's why it's really important. We try to get, I think last year we had around 600 or 800 people from the community, and the more people we can get, really the better for our numbers and things like that.
Right. Well, and like any survey, right, the more representation you can get, especially in a statewide survey, it'd be good to have at least as much of the percentage from San Juan County as you see from some of the larger metro areas to make sure that the numbers aren't skewed or have to do a lot of extrapolation perhaps as to what the results that they're getting.
Yeah, and I really want to encourage men to fill this out. They're one of our target audience that we really struggle with because there's, for various reasons, but they might not take the time to complete this, but their voice is really important. Sometimes they have a different perspective than someone else might, and so we really we try to promote it to men and younger people too. Those are two that we really struggle to get enough representation from. And so, if you're under 20, you have to be 18 to fill out the survey, but
right.
That 18 to like 22 demographic, and then men of all ages, we really encourage, take the time. I know, you might be busy, but it really, your voice can make a difference on what funding we get, what programs are out there. It's important.
Yeah, very much so. And so again, folks have from now until April 27th to take the survey. Again, the QR code is on the screen. You can point your phone at it and get there and take the survey and really help a lot of different organizations and agencies, not just in San Juan County, but across the state, who are trying to divide up funding and resources and things like that, because that's what the survey is used for, in addition to other things.
Right, and some of our funding here in the county comes through state grants that the state itself has applied for, and then puts out to the different counties. And so it really is important to have both those statewide numbers and our local numbers to identify needs. Right,
very true. My guest this morning, Amanda Evans, is here with the San Juan Health Council as part of KSJE's commitment to the San Juan Health Council. They are here on the first Tuesday of every month, April Fool's Day notwithstanding, to talk a little bit about the work that they do, and many times one of their member agencies will come as well to talk about the work that they do in our communities, and that's what the Health Council does, right? It's made up of all these different organizations, some nonprofit, mostly nonprofit, that meet once a month and decide to kind of learn about what other members are doing and things like that in the community, basically, right?
Right. We have all types. It's totally open meeting, so community organizations, nonprofits, for-profit businesses, if you do something with health or if you just care about the health of the community. Community members are welcome to attend, even if you're not affiliated with a group or something. We do meet the third Thursday of each month at 3 p.m. at the PMS Community Center in their Marion Oil Room. Mm-hmm. And this month we'll be talking, it'll be April 17th, and we'll be talking about suicide prevention.
Very, very good. Another important topic in the community, and so that's an important thing to be discussing. Just have a couple of minutes remaining this morning, Amanda. What else is going on with the Health Council? What are some of the other things you guys are working on?
So we're kind of just growing. Membership is always a big one. So if we can, increase the people attending. We just merged with, I think Chap may have been on your show in previous times, that was with the City of Farmington Homeless Solutions Task Force kind of thing. The person that was kind of running that was retiring, and so they asked us to kind of take in their membership, and so we have a focus on each meeting. We have different topics that we cover, so we have a time for behavioral health because that's one of our priorities. We have a time for homeless solutions through the CHAP work, and so we have just these different, we start with kind of a presentation, and then we go into actually doing some work around some of these issues and how can we make a difference, how can programs coordinate with each other. You know, it might be like, well, I have this service and somebody else needs it, and how do we get those people talking so they're interacting and, you know, passing clients back and forth to get the services that we really need, doing the referrals and things like that.
Nice. Very good. And I guess learning about what else is offered in the community and trying to avoid that duplication if possible. That's kind of the idea too, right?
Right. And so there's so many times, that was one of the reasons we started doing this show monthly with you, is because, you know, it's been going on 10 years now, I think, is what we figured out. And it was really because we have so many resources in the community, but people don't always know how to access that. And over the years, we've gotten some great resources that kind of help with that, like the Navigation Center and some different places in the community they can go. But it's hard sometimes. Maybe somebody's coming from a rural part of San Juan County, or they don't have internet access to just Google
right.
some of these answers. So programs like this and meetings and things help bring those resources to the forefront of people's minds.
Exactly. Very good. Well, if folks are watching or listening to us this morning and maybe want more information about the San Juan Health Council, can they reach out to you at the San Juan County Partnership, or what's the best way to get maybe more details, besides coming to the meetings, of course, but if they want to find out before the meeting, what's the best way to do that?
So they can email, if they want to be put on our email list, they can
right.
email SJHC, San Juan Health Council, so SJHC at sjcpartnership.org. If they send an email to that, then we can get them added to our email list. They'll get monthly reminders. They'll find out about the meetings. They'll get emails from our community, kind of shout outs from our partners that have events going on, things like that.
Okay, very good. Great to know. Amanda, thanks so much for coming in this morning and talking with me about the work of the Health Council. We're glad to continue our 10-year partnership with the Health Council on these Tuesdays.
No, I love being here, and I'm so glad we could share some information with the community.
Yes, indeed. Me too. Thanks for being here. Amanda Evans from the San Juan Health Council, my guest this morning right here on KSJE. KSJE and the San Juan College Native American Center present the Student Study Tip of the Week.
Hello and good day. My name is Demetrius. This is your study tip of the week. Studying without distractions is crucial. If you're studying alone, try to find a quiet space or put headphones in to block out noise from your surroundings. If you're in an area trying to study and it's just not working out, relocate. It might be frustrating to have to pick up and move, but it will be worth it once you're in a good environment. Consider putting your phone on silent or vibrate too. You can always respond to your messages after your study session.
The Student Study Tip of the Week is presented by the San Juan College Native American Center and KSJE.